Meningitis is one deadly disease that also causes lifelong disability. But the doctors will say we should call it cerebrospinal meningitis. It is caused by viruses and bacteria which may result to infection in a part of the body, and then it spreads through the bloodstream to the nervous system. Experts say 50% of people who have cerebrospinal meningitis will die if untreated. And even when treated, 10 to 20% of people who survive from the disease will have after effects such as deafness, loss of sight, loss of limbs, amongst others. Nigeria is one country with the highest record of meningitis. The most recent large-scale outbreak in Nigeria occurred between December 2016 and May 2017, with data from the Nigeria Center for Disease Control, NCDC, reporting a total of 14,280 suspected cases across 23 of the 36 states and nearly 1,200 deaths. The record said to be gradually reducing as the country between 2018 and 2019 had 1,532 people affected, and in 2020 it was less than 1,000 cases. As the World Health Organization launches the flagship global strategy of defeating cerebrospinal meningitis by 2030, these questions remain on the minds of many. Has Nigeria done enough to deal with the vaccine-preventable disease? Why is the country one of the most affected globally? And what preventable measures are best suitable for our country? Answers to these questions will be the focus on the program Nigeria Today. I am Lydia Otijochi. Welcome to the program. Thanks for staying. With me to discuss how to defeat cerebrospinal meningitis in Nigeria is the Director of Special Duties, and she is the lead of the National Cerebrospinal Technical Working Group of the NCDC, Dr. Priscilla Ibekwe. Welcome to Nigeria Today.
Thank you.
Also with us is a consultant of public health with the Department of Health and Human Services Secretariat, FCTA, Dr. Austin Ajogu. Nice to have you on board.
Thank you for having me here.
Now let's start by knowing more about cerebrospinal meningitis. What is it? Dr. Priscilla.
Thank you for that question. Cerebrospinal meningitis is an inflammation of the covering of the brain and also the spinal cord. And when this happens, it does cause a lot of signs and symptoms to the person that is infected or affected by this. And usually it's caused by, the cerebrospinal meningitis can also be caused by bacteria, by viruses, by fungi. There are quite a number of causes for it. And we are very concerned because this is a vaccine for those that are caused by bacteria. It's vaccine preventable, and we want to do the best that we can to ensure that these cases are reduced. We continue to reduce the cases in Nigeria.
Okay, now let us go to Dr. Austin. How, or maybe I should put it this way, what is the mode of transmission of the disease?
It's being transmitted from person to person, especially in overcrowding environment, in a poor environment, people staying together. Those things help it to spread from person to person, especially when there's an outbreak.
Okay. Now, it's really scary to hear that Nigeria is one of the countries with the highest rate of the disease. Why is this so?
I think why it is so is that, one, the good news is that meningitis is treatable and preventable. But in our environment, if you look at vaccine coverage, it has always been low for quite a while now. The last MICS multi-indicator survey that was done, about 18% coverage of vaccine, and this is one of the causes of the problem. So the problem is a vaccine preventable disease, but the coverage is quite low. nationally.
Okay. Now, Dr. Priscilla, it is said that the disease has been found to occur throughout the year in Nigeria, with an observed increase during the dry season. What part of the region of the country is most affected, and why the dry season?
So, like my colleague has just said, it's person to person and also droplet infection. What that means is some secretions coming out from the nose, so especially when somebody is sneezing and coughing. And we know, we've seen, the data clearly shows that it occurs throughout the year, but it happens a lot more during the dry season. And Nigeria happens to fall under the meningitis belt. There are about 26 countries across Africa that are affected by meningitis. That you have more during during the hot season. They tend to have a lot more cases of meningitis, and at least 26 states in Nigeria you record meningitis during this time. All 19 northern states of the Federation are within that meningitis belt, and we are beginning to see cases in other parts of the country, like Ebonyi State or your state. So the point to note really is that meningitis occurs throughout the year. So it's not for anybody to feel that they may not be able to get meningitis, but we tend to see a higher number of cases during the meningitis season. And for that, we always try and work very closely with our sister agencies, like the Primary Healthcare Development Agency, which is very in tune in terms of the vaccine, dealing with vaccine provision, in vaccination programs, and also in our preparation in Nigeria, we work very closely also with NIMET to give us the weather predictions, and this helps us to do a risk assessment in all states of the Federation, using both the climate and other parameters to determine what areas might we expect an outbreak.
Okay,
that is to identify the states that are at highest risk, and we do that every year.
Okay, now we'll talk about those states much later when we get back to you. Now, Dr. Austin, is cerebrospinal meningitis treatable? Can it be totally cured?
Like I said, it is treatable and preventable. The problem is early reporting, early detection of the disease, because a lot of people in our environment don't go to hospital early enough, and our health scheme behavior is quite poor. So early detection is key, and when it comes, we have antibiotics that can be used to treat them. Sometimes laboratory facility is also key to determine the susceptibility of the bacteria to those drugs. It's treatable. We have them available. If you are in a facility that cannot do those tests, you can just use a broad spectrum antibiotics that can be used to treat the meningitis. So it's treatable.
Okay.
I'd like to add something here, and that is to say that meningitis is a race against time, in the sense that somebody that has meningitis symptoms can start off, I'll come to the symptoms in a minute, but to say that somebody that has meningitis can start off feeling unwell, having a high temperature, headache, difficulty, sensitivity to light, not coping with light. Sometimes the person may have a neck stiffness, and for a child they lose their appetite. Even somebody can easily, may even complain of being drowsy and not being able to wake up a child. You feel this person has slept enough, but the person is still so drowsy. The point to make here is that a person with meningitis can die within 24 hours. So it's a race against time, that when you recognize the signs and symptoms of meningitis, just like I've said, you need to go to the hospital. It's not something to treat. And so what we're asking parents, we're asking neighbors, we're asking relatives and friends, when somebody, when somebody's complaining about certain symptoms as I've outlined, you want to advise them to quickly get to the hospital. And when they go to a primary healthcare center or go to the hospital, the healthcare workers are trained to recognize the signs and symptoms of meningitis, and if it's something that they can't treat, they send them straight to the designated treatment centers for meningitis.
Okay, now Dr. Austin, she's talking.
The key word here is
okay.
high index of suspicion, because especially in children, they are just come irritable and little fever. So it's high index of suspicion is key to detecting meningitis, especially in children.
Yes, I was going to add that children don't talk. How should parents know when a child is showing symptoms or signs of meningitis?
Just like I said, early detection and reporting to the health center, so that that patient will be assessed to determine what there are clinical signs that you use to determine that this is likely a meningitis case.
Okay.
So early reporting to healthcare and health seeking behavior will improve early detection of the
So the
meningitis cases.
Clear symptoms are a child is not eating well, sleeping drowsy, very, very drowsy, child not wanting to eat, high temperature. Sometimes there's neck stiffness. Every mother knows how the neck of her child is, and if there's a form of stiffness. And also for a child that is less than 1 year, there's something called a bulging frontanel. When mothers run their hand over a child's head, there's this part that kind of is deep. But when a child has meningitis, it's like sometimes they have that area that it's a bit kind of swollen. It appears kind of swollen to the mom. Okay. And for an adult, difficulty, sensitivity to light. So the light that we are under, or if, let's say the sunlight that they would normally tolerate, they can't deal with that sunlight. Okay. The point is, this is not the time to stay at home. It's better to go straight to the hospital and let a healthcare worker, like my colleague says, healthcare workers are already trained. They have the high index of suspicion. They recognize, once they see these patients, they know what to do.
Okay. Now, we've been told that it's a vaccine preventable disease. Now, let's talk about accessibility and availability of vaccines in our country. Dr. Austin.
It is good to know that we have the vaccines available. And before a child is 1 year old, supposed to have completed all these vaccines, right from 6 weeks when you start taking PVC or Haemophilus influenza type B, then to 9 months when you take measles vaccine. So by the time you're celebrating your first birthday, first 1 year of life, you're supposed to have taken all these vaccines that will prevent you from having any of the bacteria-related meningitis.
Okay.
And I just want to add something to that. The good news is, so for example, in the early 90s, we had, 1990s and all that, we had very big meningitis outbreaks. And then there was this Menafevic, that's the meningitis A vaccine that was introduced, and it drastically reduced meningitis caused by Neisseria meningitidis type A. And the great news is that now is now included as part of our routine immunization. And in the past 5 years, it was introduced, and in the past 5 years, we've seen the cases of meningitis falling. Not only that, we've not seen cases of meningitis, Neisseria meningitidis type A. What is that saying? That our vaccines work. Okay. And when we've looked at the data, we've also identified that many of these people that had meningitis, many of them had not taken their vaccines. So we are actually asking patients, asking people, please help us with your neighbor, with your auntie's children. Let them go for their vaccination. Okay. Vaccines work.
Thank you. Now it's time to take a break, but we'll be back in a short while to continue with the discussion. Don't go away. It's Nigeria Today. Welcome back. You're watching Nigeria Today and we're discussing cerebrospinal meningitis, strategies to curb the disease in Nigeria. Now, Dr. Austin, apart from vaccines, what else can be done to prevent the disease in Nigeria?
Actually, what we are doing is an epidemic-prone disease. And because it's an epidemic-prone disease, any case of meningitis will be reported so that decisive action should be taken. And if you look at the roadmap 2030, one of the things the activities that are mapped out is improved surveillance. That's you do what they call enhanced surveillance to ensure that all cases of meningitis is detected in all the communities and the environment, and also improve risk communication and community engagement so that that will improve their health-seeking behavior. Advocacy is also there, and capacity building to be able to identify cases of meningitis in the environment and in the communities.
Okay. Dr. Priscilla, you'd like to add to that?
Yes, so also it's very important that people are aware, like I always say, the signs and symptoms of meningitis and support people who are affected by meningitis. You will know very clearly that 10 to 20% of people who have meningitis have after effects, what are we top complications of meningitis. And many of these are long-term. They may last for life. So some people lose, deafness, loss of limbs, loss of sight. Sometimes it may even affect people's learning a little bit, or sometimes behavioral issues and concerns or difficulties. So again, these things are long-term. So it's very important that we put together a comprehensive package of care for people who are affected by meningitis, not only in the health service, so for somebody who is deaf, to ensure that they continue to go to hospital and get some support, but also in their schools. There's something that can be done in the health sector in the education sector to support a child who's been who is a survivor of meningitis. And also the social sector, social service. And when this person grows up, he needs to be trained to be productive so that he's able to, keep a job and stay in work. That is absolutely important. So there needs to be a funding to support a comprehensive package of care for a person affected by meningitis. And finally, to also note that parents or people caring, families of somebody who has been affected by meningitis need support, because this thing is long care. So even the family, also their mental health. You can imagine a mother who possibly went to market, came back and saw that her child was feeling sick while she just dashed to the market. Some of these people have guilty conscience and felt, oh, I shouldn't have gone to market today, and all that, and they live with that guilt, what they could have done and what they could not have done. Of course, it had nothing to do with them. So they have to be supported. Their mental state needs to be supported to ensure that people are able to cope. And for a family that is dealing with a child with disability, we know how tasking that can be on the family and even on their economic status and their ability to work. So the whole community needs, my colleague has just said something around community engagement. We need to wrap a package of care around them, right from all sectors of the community and our social services.
Thank you, Dr. Priscilla. Now, Dr. Austin, with the COVID-19 pandemic, how challenging is it to pay attention to other diseases like cerebrospinal meningitis? And what is the risk of not investing enough on them too?
Granted that COVID-19 has reduced resources that we have, and has affected other essential services. But that notwithstanding, the surveillance is ongoing, community engagement is ongoing, advocacy is ongoing to let them know that all these diseases are still there. And as a public health physician, we're always on the field looking for all these epidemic-prone diseases, in spite of the challenges that we are facing with COVID-19. So all these activities geared towards ensuring that all the epidemic-prone diseases are identified early and reported. All these activities are ongoing.
Okay. Now, still staying with you, The World Health Organization has flagged up a roadmap to ending meningitis by 2030. Is this possible? And what are the plans on ground towards this direction in our country, Nigeria?
Yes, it is a very good roadmap, and it's possible if you have the commitment of the government, the commitment of all the stakeholders. Because in that roadmap, there are activities, like I said, involving surveillance, involving risk communication and community engagement, involving advocacy, in ensuring that there's commitment, they get commitment from partners, from government, to ensure that all these epidemic-prone diseases are being detected and reported on time. And also, there is also capacity and resources, capacity building in terms of laboratory to ensure that they have the capacity to identify these diseases and also serotype them to determine the type of bacteria that is affecting the population. So if they get the commitment, I think it only needs the commitment of the government and stakeholders to achieve it. And it is one of the packages of universal health coverage. Without it, we are not going to achieve universal health coverage.
Okay. Now,
So in addition to what my colleague has just said, you'll recall that with this roadmap, it's a welcome development for the whole world. And it's really a welcome development, especially for Africa, knowing fully well that a high proportion of people who have meningitis, come from the African continent, including Nigeria. And one of the pillars that is on the roadmap is actually about advocacy.